Diseases and disorders of the eye and ear. Vision begins when an image is focused on the retina, the innermost layer of the eye. Photoreceptor cells, rods and cones, detect light and color, converting them into nerve impulses. These impulses travel through the optic nerve to the brain, where the image is interpreted. The eye itself is structured in three layers: the sclera on the outside, the choroid in the middle, and the retina on the inside, which is continuous with the ciliary body and iris. This diagram illustrates the cross-sectional anatomy of the eye, a complex organ responsible for vision. The outermost layer includes the sclera, which provides structure, and the cornea, which helps focus incoming light. The choroid lies beneath the sclera and contains blood vessels that nourish the eye. Inside, the retina houses photoreceptor cells that detect light and send signals through the optic nerve to the brain. The lens adjusts shape to focus light onto the macula, the area responsible for sharp central vision. Other important features include the iris, pupil, vitreous body, and the optic disc, which forms the blind spot where the optic nerve exits the eye. Muscles like the medial and lateral rectus control eye movement, while structures like the anterior chamber and ciliary muscle maintain pressure and focus. The optic nerve passes through the fibrous layers of the eye at a region called the optic disc, also known as the blind spot. From there, it transmits visual impulses to the brain for processing. The conjunctiva is a thin, transparent membrane that covers the front part of the sclera and lines the inside of the eyelids, helping to protect and lubricate the eye. The anterior chamber lies between the cornea and the iris and is filled with aqueous humor, which maintains pressure and nourishes internal structures. Behind the lens is the vitreous body, a clear, gel-like substance that helps maintain the eye's shape and keeps the retina in place. The cornea and lens are capable of bending or refracting the light rays so that they can be focused on the retina. The image is turned right side up and forward in the brain as the brain interprets the visual concept. Each eye has 6 extrinsic muscles that control the movements of the eye. These muscles pull on the eyeballs, making the two move together to converge on one visual field. Eye disorders can present with a wide variety of symptoms. Redness, itching, and burning sensations may indicate irritation or infection. Swollen eyelids, eye discharge, or sores around the eye may suggest bacterial, viral, or allergic conditions. More serious signs include visual disturbances, unequal pupils, sudden loss of vision, or persistent pain, which require urgent medical evaluation. Several tests are used to diagnose eye disorders and evaluate vision health. Eye charts and visual field tests assess clarity and peripheral vision. Tonometry measures the intraocular pressure within the eye and is important in detecting glaucoma. Eye cultures are performed to identify bacterial or viral infections. Advanced tests include electronystagmography, which tracks the direction and degree of involuntary eye movement, or nystagmus, and electroretinography, which measures the electrical activity of the retina. These specialized tests provide insight into deeper neurological or retinal issues affecting vision. Hyperopia occurs when the eyeball is abnormally short as measured from front to back. Myopia occurs when the eyeball is abnormally long as measured from front to back. In astigmatism, the front of the cornea may be more egg-shaped than spherical, thereby causing light rays to be unevenly or diffusely focused across the retina. What are the signs and symptoms of refractive errors? The primary symptoms of a refractive error are blurred vision and eye fatigue, which can lead to squinting, frequent rubbing of the eyes, and headaches. Eye health history and tests for visual acuity and refraction are used to diagnose refractive errors. Excellent results can be expected with correctly prescribed eyeglasses or contact lenses. Hyperopia, or farsightedness, occurs when light rays entering the eye focus behind the retina instead of directly on it. This usually happens because the eyeball is too short or the cornea lacks enough curvature. As a result, close objects appear blurry while distant objects remain clearer. Correction is achieved using a biconvex lens, which bends light rays inward to ensure they focus properly on the retina. With corrective lenses, people with hyperopia can see both near and distant objects more clearly. Myopia, or nearsightedness, occurs when light rays focus in front of the retina, rather than directly on it. This usually happens when the eyeball is longer than normal, which causes distant objects to appear blurry while nearby objects remain clear. To correct this, a biconcave lens is used to diverge incoming light rays so they focus properly on the retina. With this correction, individuals with myopia can clearly see both near and far objects. Nystagmus is involuntary, repetitive, rhythmic movements of one or both eyes. What is the difference between congenital and acquired nystagmus? Congenital nystagmus is manifested before 6 months to 1 year of age and is the most common type. Acquired nystagmus results when a disease process produces lesions in the brain or inner ear. Congenital nystagmus often can be lessened by using the Kessenbaum procedure, in which the eyes are surgically rotated toward the null point of the eye. In acquired nystagmus, the patient benefits from understanding the underlying cause and treatment of the nystagmus. Parents of the child with congenital nystagmus are given support and clear explanations about the condition and the surgical treatment, if indicated. Strabismus is failure of the eyes to look in the same direction at the same time, which primarily occurs because of weakness in the nerves stimulating the muscles that control the position of the eyes. Schedule a comprehensive ophthalmic examination. Amblyopia is reversible until the visual pathways fully develop at about 7 to 8 years of age. Give parents of children with strabismus an explanation of the condition and the cause if known. Reinforce the importance of early treatment to help prevent visual loss. This image shows strabismus, a condition where the eyes are misaligned and do not look at the same point simultaneously. The condition may be congenital or develop later in childhood. One eye may turn inward or esotropia, outward or exotropia, or move up or down independently. If not corrected early, strabismus can lead to amblyopia, or lazy eye, which results in permanent vision loss in the affected eye. Treatment may include corrective lenses, eye exercises, or surgery to realign the muscles and restore binocular vision. The eyelid can be affected by several conditions, ranging from infections to structural problems. A hordeolum, or sty, is a painful infection of the eyelash follicle or oil gland, often caused by bacteria. A chalazion is a painless lump caused by blockage of a meibomian gland and may require surgical drainage if it doesn't resolve. Keratitis is inflammation of the cornea, often due to infection, and may affect vision. Blepharitis involves chronic inflammation of the eyelid margins, often linked to bacteria or skin conditions. Entropion is when the eyelid turns inward, irritating the eye, while ectropion is the outward turning of the lid, leading to dryness and exposure. Blepharoptosis, or drooping of the upper eyelid, may be congenital or acquired, sometimes interfering with vision. Finally, conjunctivitis, or pink eye, causes redness, irritation, and discharge, and may be viral, bacterial, or allergic in origin. Hordeola or styes are acute, painful abscesses of an eyelash follicle or in a sebaceous gland of the eyelids. Patients complaining of a lesion of the eyelid, with or without purulent drainage, require an appointment with their healthcare provider for an examination of the affected area. Visual examination alone is usually sufficient for making the diagnosis. If surrounding soft tissue becomes infected or cellulitis, Oral antibiotics may be needed. If persistent, these lesions need to be surgically drained. A hordeolum, commonly known as a stye, is an acute infection of the eyelid, typically caused by Staphylococcus aureus. It presents as a painful, red, swollen bump near the base of the eyelashes and may produce pus. The infection can be external, affecting the eyelash follicle, or internal, involving deeper oil glands. Treatment includes applying warm compresses several times a day to promote drainage. In some cases, topical or oral antibiotics may be prescribed. Patients should avoid squeezing or popping the stye to prevent spreading the infection. A chalazion is a non-infectious eyelid lump caused by blockage of a meibomian gland, which normally secretes oil into the tear film. Though it may look similar to a stye, a chalazion is typically painless and slow-growing, though it can become red, swollen, and tender if infected. Treatment involves warm compresses to soften the blocked material and topical antibiotics if infection is suspected. Larger or persistent chalazia may require minor surgical removal. It's important to reassure patients that the procedure is simple and quick, often performed under local anesthesia. This image shows a classic chalazion, a firm, localized swelling on the lower eyelid. Unlike a stye, a chalazion is typically not painful, although it may become red or tender if secondarily infected. The lump forms gradually and can press on the eyeball, leading to mild blurred vision or irritation. Most chalazia resolve with warm compresses and time, but persistent or large ones like the one shown here may require simple surgical drainage. Patients should be advised to avoid squeezing the lesion and seek care if symptoms worsen. Keratitis is any inflammation or infection of the cornea. The patient experiencing the symptoms listed earlier is scheduled for a prompt ophthalmic examination. Other forms of keratitis can be caused by corneal trauma or exposure of the cornea to dry air or intense light, as occurs during welding. Examination of the cornea using a slit lamp confirms the diagnosis. Ophthalmic moisturizing ointments and eye drops may be prescribed for symptomatic relief. Teach the patient the proper technique for installation of ophthalmic ointment and eye drops as prescribed. Keratitis is an inflammation of the cornea, the clear, protective front layer of the eye. It may be caused by bacterial, viral, or fungal infections, with herpes simplex virus being a common culprit. Symptoms include eye pain, redness, photophobia, tearing, and decreased visual acuity. This image shows visible corneal haze and redness, classic signs of active keratitis. Prompt treatment with broad-spectrum antibiotics or antivirals is essential to prevent complications like corneal ulcers or vision loss. Patient education should include strict hygiene and avoiding contact lens use during infection. Blepharitis is inflammation of the margins of the eyelids involving hair follicles and glands. The patient experiencing irritation of the eyelids with crusts, itching, and burning needs a prompt clinical evaluation. Visual examination of the eyelids and the presence of collarettes, tiny scales, can determine the presence of staphylococci. The condition can sometimes be resistant to treatment and may become chronic if not properly treated. What is included in eyelid hygiene? Eyelid hygiene includes rigorous cleaning of the eyelids and lashes with a clean, warm washcloth daily. Teach the patient the proper technique for instilling ophthalmic ointment and eye drops as prescribed. Blepharitis is a chronic inflammation of the eyelid margins, often involving buildup of crusty debris, as shown in this image. It can be ulcerative due to staph infection or non-ulcerative caused by seborrhea, allergies, or environmental irritants. Common symptoms include itching, burning, redness, and a gritty sensation in the eyes. Treatment focuses on eyelid hygiene, such as cleansing with diluted baby shampoo or medicated wipes, and in some cases, topical antibiotics or anti-inflammatories. Consistent eyelid care can help prevent flare-ups and complications like styes or conjunctivitis. Entropion is a condition where the eyelid turns inward, causing the eyelashes to rub against the eye. This creates the sensation of a foreign body, along with tearing, itching, and redness. It most often affects older adults due to weakening of eyelid tissues. A simple visual examination confirms the diagnosis by revealing the eyelid's inward position. Treatment usually involves a minor surgical procedure to reposition the eyelid. Patients should be advised not to rub their eyes, as this can lead to infection or corneal damage. This illustration shows entropion, where the eyelid margin and eyelashes turn inward, coming into contact with the cornea and conjunctiva. The constant friction can cause discomfort, redness, and potential corneal injury if untreated. Entropion is most commonly seen in older adults due to muscle laxity and can worsen over time. Surgical correction is typically straightforward and effective in restoring proper eyelid alignment and protecting the eye's surface. Ectropion is a condition in which the lower eyelid everts from the eyeball, and the exposed surface of the eyeball and the lining of the eyelid become dry and irritated. A scar on the eyelid or cheek that contracts and pulls the eyelid downward can cause a cicatricial ectropia. Assure the patient, who often is elderly, that a minor surgical procedure can correct the problem. This diagram illustrates ectropion, a condition in which the lower eyelid turns outward, exposing the inner lid and lashes. This outerning prevents the eyelid from properly covering and protecting the eye surface. As a result, patients may experience dryness, tearing, and irritation, which can lead to further complications like conjunctivitis or corneal exposure. Ectropion is commonly age-related and typically corrected through a minor surgical procedure to restore normal lid position. Blepharoptosis, also called ptosis, is a permanent drooping of the upper eyelid, such that it partially or completely covers the eye. The condition usually only affects one eye. When vision is affected, or a previously normal upper eyelid has begun to droop, a physician should be consulted. Explain the relationship between the ptosis and the underlying disease, if known. If surgery is scheduled, describe the procedure to the patient and provide written postoperative instructions, if appropriate. Blepharoptosis, or ptosis, is the drooping of the upper eyelid, as shown in this diagram. It can be congenital or acquired due to nerve damage, muscle weakness, or age-related changes. In severe cases, it may partially or completely block the pupil, affecting vision. Diagnosis involves assessing eyelid position and muscle strength. Treatment ranges from watchful observation in mild cases to surgical correction when the drooping interferes with vision or causes significant asymmetry. Conjunctivitis, also known as pink eye, is inflammation of the conjunctiva, the thin membrane covering the white part of the eye and inner eyelids. Symptoms include redness, swelling, itching, a foreign body sensation, and excessive tearing. The eyes may also become sensitive to light. It can be caused by bacterial or viral infections, or by allergic reactions and chemical irritants. Diagnostic testing may involve collecting samples of eye discharge to determine the cause. Treatment is based on the underlying agent, and avoiding the offending trigger often leads to full symptom resolution. This image shows a classic case of conjunctivitis, with visible redness, swelling, and mucus discharge from the lower eyelid. The conjunctiva appears inflamed, and there may be a yellow or green discharge, suggesting a bacterial infection. Viral forms typically produce a watery discharge, while allergic conjunctivitis is marked by itching and both eye involvement. Regardless of the cause, Patients should avoid touching or rubbing the eye and practice good hygiene to prevent spreading the infection. Each of these conditions will be discussed in more detail in the coming slides. A corneal abrasion is the painful loss of surface epithelium or outer layer of the cornea. A corneal ulceration is an infection of the cornea. The physician should be consulted for instructions immediately after documenting a thorough history of any chemicals the eye has been exposed to. The diagnosis is confirmed by the presence of characteristic symptoms as well as by a visual examination of the patient. Application of an eye dressing may be needed to promote healing. Most corneal abrasions heal spontaneously. Teach the patient the proper care of an eye dressing and the technique for instilling ophthalmic ointment and eye drops as prescribed. Inflammation of the episclera or the external surface of the sclera is episcleritis. Inflammation of the deeper sclera, the white outermost covering of the eyeball, is called scleritis. Eye pain and redness indicate the need for an ophthalmic examination as soon as possible. Diagnostic evaluation may include ultrasonography, magnetic resonance imaging, or both to identify infectious or autoimmune connective tissue disease. Perforation of the sclera, which is rare, necessitates a surgical repair called a scleroplasty. Describe the postoperative regimen and stress the importance of follow-up care. A cataract is an opacification or reduction of signal of the natural lens of the eye. Patients reporting changes in visual acuity and or glare should be given the first available appointment for an ophthalmic examination. Long-term, unprotected exposure to sunlight is considered causative as well. Ophthalmoscopy, with dilation of the eye and a slit lamp examination, confirms the presence of a cataract. There is no known prevention method. Give the patient written instructions regarding the technique for instilling eye drops and all other medications, how to apply the eye shield carefully, and any limitation of activities during recovery. A cataract is a clouding of the eye's natural lens, as shown in this image where the pupil appears gray or milky. Cataracts develop gradually and are often related to aging, though they may also be congenital, traumatic, or associated with diabetes or medications like corticosteroids. Patients commonly report blurred vision, glare, difficulty with night driving, and faded color perception. Treatment involves surgical removal of the cloudy lens and replacement with a clear artificial lens, which typically restores vision effectively. Glaucoma is damage to the optic nerve in the presence of elevated intraocular pressure. Fluid circulates freely between the posterior and anterior chambers of the eye and passes through the trabecular meshwork and drains into the general circulation. Encourage patients, especially those with the risk factors listed earlier, to have a regular ophthalmic examination and appropriate testing. Chronic open-angle glaucoma, a silent disease, is the most common form of glaucoma and is the most treatable cause of blindness. Chronic open-angle glaucoma can occur secondary to trauma, even years later. Overuse of topical steroids also can cause the condition. Explain the type of glaucoma and the treatment regimen. Teach the patient the proper technique for instilling ophthalmic ointment and eye drops as prescribed. This diagram shows the two major forms of glaucoma. A disease that damages the optic nerve, often due to elevated intraocular pressure. In open-angle glaucoma image A, the drainage angle remains open, but the trabecular meshwork becomes partially blocked, leading to a gradual increase in eye pressure. This form is often asymptomatic until vision loss occurs. In closed-angle glaucoma image B, the iris bulges forward and blocks fluid drainage, causing a sudden spike in pressure. This type is a medical emergency, with symptoms such as eye pain, halos around lights, and rapid vision loss. Both types can lead to permanent blindness if left untreated. Macular degeneration is a progressive deterioration or breakdown of the macula of the retina. Macula. Oval-shaped pigmented area near the center of the retina. The condition is usually painless, develops slowly, and does not affect the peripheral vision. Macular degeneration is often considered to be age-related. Therefore, the mature adult is encouraged to have regular ophthalmic examinations. Macular degeneration usually is caused by degenerative changes in the pigment epithelium of the retina. Vitamin therapy called AREDS and protecting the eyes from ultraviolet rays and bright light are considered prudent measures. Amsler grid. In the test, the person looks with each eye separately at the small in the center of the grid. Patients with macular disease may see wavy lines or some lines may be missing. Macular degeneration is a progressive condition that damages the macula, the part of the retina responsible for central vision. In Image A, the retinal photo shows signs of drusen, yellow deposits that indicate early changes. Over time, central vision becomes distorted or lost, making reading and recognizing faces difficult. Image B displays an Amsler grid, used to detect early vision changes. Patients with macular degeneration may report wavy lines, dark spots, or areas of blurred vision on this grid. While there is no cure, early detection and management, such as nutritional supplements and injections, can slow progression. Diabetic retinopathy is pathologic alterations of the retinal blood vessels and the pathologic proliferation of retinal vessels. The diabetic patient is encouraged to have frequent ophthalmic examinations, at least annually. Diabetes causes poor circulation in the retinal blood vessels and may cause leakage of exudate into the retina. Sometimes, fragile new blood vessels neovascularization can grow and lead to leakage of blood into the vitreous humor. Maintaining tight blood glucose control can prevent the onset of diabetic retinopathy and can improve any existing retinopathy. Diabetic retinopathy is a leading cause of vision loss in adults with long-standing diabetes mellitus. Image A shows non-proliferative retinopathy, where damaged blood vessels leak fluid or blood into the retina, causing microaneurysms, hemorrhages, and macular edema. Image B illustrates proliferative retinopathy, a more advanced stage where the retina responds by forming new, fragile blood vessels. These vessels can rupture easily, leading to bleeding, retinal detachment, or blindness. Early detection through regular eye exams and treatment with laser photocoagulation or anti-VEGF therapy can significantly reduce the risk of vision loss. A retinal detachment is an elevation of the retina from the choroid. Early symptoms of detachment consist of the patient seeing many new floaters and light flashes. Irreversible blindness can result from untreated retinal detachment. Use visual aids to explain the condition and the treatment to the patient. Prepare the patient for post-surgical procedures and treatments. Retinal detachment is a serious condition where the retina separates from the underlying choroid layer, cutting off its blood supply. In this diagram, you can see how a hole or tear in the retina allows fluid to accumulate, lifting the retina away from the supporting tissues. Symptoms may include sudden flashes of light, floaters, or a shadow or curtain appearing over part of the visual field. This is a medical emergency, and prompt treatment with laser therapy, cryotherapy, or surgical repair is needed to prevent permanent vision loss. Uveitis is inflammation of the uvea, the middle layer of the eye, which includes the iris, ciliary body, and choroid. Symptoms may include eye pain, light sensitivity or photophobia, blurred vision, and eye redness. A full ophthalmic exam is needed to confirm the diagnosis and rule out other causes. Uveitis is often associated with autoimmune diseases, infections, or inflammatory bowel disease. Treatment typically involves topical corticosteroids, and in more severe cases, systemic steroid therapy may be required. Exophthalmos is the abnormal protrusion of one or both eyes, often associated with thyroid eye disease. Patients may experience dryness, a gritty sensation, double vision, or difficulty moving the eye. It is typically caused by enlargement of the extraocular muscles, retrobulbar masses, or inflammation of orbital tissues. Diagnosis determines the appropriate treatment, which may include medications to reduce inflammation or manage underlying thyroid conditions. In severe cases, surgical decompression may be required. Patients should be educated on medication purpose and dosing schedules to ensure optimal results. Cancer of the eye may involve the globe, orbit, optic nerve, or eyelids. Tumors of the eyelid often present as visible lesions, such as seborrheic keratosis, which may look like a skin tag. Ocular melanoma might appear as a growing pigmented spot on the iris. Infants should be evaluated for signs like leukocoria, a white pupil reflex, and strabismus, which can signal retinoblastoma. Ocular tumors include retinoblastoma, ocular melanoma, and intraocular lymphoma. Orbital tumors include rhabdomyosarcoma, capillary hemangioma, and cavernous hemangioma. Eyelid tumors may be benign or malignant, like skin cancer or papillomas. Optic pathway glioma, often seen in children, is a slow-growing tumor of the optic nerve. Retinoblastoma is a rare but serious eye cancer affecting infants and young children. It may be inherited or occur sporadically. Parents or doctors may notice a white reflection in the pupil, called leukocoria or eye misalignment. Prompt diagnosis and treatment are essential to preserve vision and prevent metastasis. Ocular melanoma may be first noticed during a routine eye exam. Ultrasound imaging helps confirm the diagnosis. Tumors on the eyelid are typically biopsied to determine if they are benign or malignant. Treatment depends on the type, size, and location of the tumor and may include surgery, radiation, or chemotherapy. The ear is composed of three sections: the outer, the middle, and the inner ear. What is the function of the auditory canal? The function is to collect sound waves, or vibrations, from the air or environment and channel them to the tympanic membrane eardrum, which then begins to vibrate. The cochlea contains tiny hairs that change the sound waves in the fluid into nerve impulses, which then are transmitted to the brain via the auditory nerve. The labyrinth is responsible for maintaining balance. It consists of three connected tubes bent into half circles, called the semicircular canals. This diagram shows the structures of a healthy ear. Sound waves travel through the outer ear and cause vibrations in the eardrum. These vibrations move through the ossicles, malleus, incus, and stapes, and into the cochlea. The hair cells in the cochlea convert these vibrations into electrical signals sent to the brain via the auditory nerve. A cochlear implant is a medical device used to treat sensorineural hearing loss, especially when hearing aids are ineffective. It bypasses damaged portions of the ear and directly stimulates the auditory nerve. The system includes an external processor and internal electrodes. Cochlear implants can restore partial hearing and improve communication in people with profound hearing loss. Conductive deafness is caused by an impairment of the eardrum or bones in the middle ear, which conduct sound waves to the cochlea in the inner ear. Sensorineural deafness, or nerve deafness, results from impairment of the cochlea or the auditory nerve. Cochlear implant systems are complex and include an electrode array, a receiver, a speech processor, a transmitting coil, and a microphone. The electrode array is placed surgically in the cochlea, and the receiver is implanted and fixed to the skull behind the mastoid bone. Cochlear implants do not restore normal hearing. However, they can improve a deaf person's functioning in a hearing world. Candidates for the implants are selected carefully and should have a severe to profound bilateral sensorineural hearing loss and be older than 2 years of age. Conduction disorders involve issues in the outer or middle ear that interfere with sound transmission. These include impacted cerumen, otitis externa swimmer's ear, otitis media, and otosclerosis. These conditions often cause temporary hearing loss, ear pain, and sometimes fever. Early diagnosis and treatment are crucial to avoid permanent damage. Impacted cerumen or earwax buildup can block the ear canal and cause hearing loss, tinnitus, and a sensation of fullness or pressure. Causes include dry skin, excessive hair in the canal, or improper use of cotton swabs. Removal may require softening drops followed by irrigation. Patients should be advised not to insert objects into the ear canal to avoid packing the wax deeper. In this image, impacted cerumen is shown blocking the ear canal. Before removal, the wax may need to be softened with oil-based drops. Once softened, gentle irrigation with warm water can flush it out. Proper patient education includes avoiding cotton swabs and following instructions for ear hygiene. Ear irrigation is a common method used to remove impacted cerumen. It involves gently flushing the canal with body temperature water to avoid dizziness or pain. It's important to ensure the tympanic membrane is intact before irrigation. This technique should be performed carefully to avoid damaging the ear canal or eardrum. Also known as swimmer's ear, otitis externa is an infection of the outer ear canal. It often results from water trapped in the ear, which creates a breeding ground for bacteria or fungi. Symptoms include severe ear pain, itching, swelling, hearing loss, and sometimes fever. Treatment includes topical antibiotics, steroids, and keeping the canal dry and clean. This image shows a red, swollen ear canal consistent with otitis externa. The condition can develop quickly and become quite painful. Diagnosis is confirmed with otoscopic exam and symptom history. Preventive care includes drying the ears after swimming and avoiding trauma from cotton swabs or earplugs. Swimmer's ear is a common form of otitis externa. Water trapped in the canal mixes with cerumen and creates a moist environment for bacterial growth. Treatment may involve antibiotic or steroid ear drops and oral antibiotics in more severe cases. Encourage patients to complete all prescribed medications and keep the ear dry during recovery. Otitis media is a middle ear infection and can be serous or clear fluid or suppurative or infected fluid. Serous otitis causes pressure and hearing loss without signs of infection. Suppurative otitis presents with fever, pain, nausea, and fluid drainage. It often results from viral upper respiratory infections that travel through the eustachian tube. Chronic otitis media can follow repeated acute infections or be linked to enlarged adenoids or chronic sinusitis. Bacterial infection is common in suppurative otitis media. Treatment includes analgesics, decongestants, and sometimes antibiotics. In some cases, myringotomy tubes are placed to promote drainage and prevent recurrence. This image depicts an inflamed tympanic membrane associated with acute otitis media. The ear may appear red, bulging, and may leak fluid or pus. Children may tug at the affected ear, have difficulty sleeping, or develop fever. Early treatment helps prevent complications such as hearing loss or tympanic membrane rupture. Chronic otitis media may present with persistent ear discharge, hearing loss, and tympanic membrane perforation. It often results from inadequately treated acute infections. Imaging and culture help guide long-term treatment. Management may include antibiotics, ear drops, and sometimes surgical repair of the tympanic membrane. Suppurative otitis media involves infection and the buildup of pus behind the eardrum. Symptoms include fever, pain, hearing loss, and sometimes ear drainage. The condition is typically caused by bacteria, especially after upper respiratory infections. Timely treatment with antibiotics and sometimes surgical drainage is critical to prevent complications like mastoiditis or hearing impairment. This slide shows a normal versus infected tympanic membrane. A healthy eardrum is translucent and pearly gray, while an inflamed one may appear bulging, red, or ruptured. Recognizing these changes through otoscopic exam helps diagnose otitis media and other middle ear pathologies. Treatment aims to reduce inflammation and promote healing. A myringotomy tube is a small tube inserted into the eardrum to allow fluid drainage and equalize middle ear pressure. It's commonly used in children with chronic otitis media or persistent effusions. These tubes help restore hearing and prevent recurrent infections. They usually fall out on their own after several months. This image demonstrates the myringotomy procedure, in which a small incision is made in the eardrum to place the tympanostomy tube. It's often performed under brief anesthesia and is well tolerated. Patients and families should be instructed on ear protection and follow-up care to monitor tube position and function. Otosclerosis, an abnormal bone growth in the middle ear, primarily affects the stapes, the third bone or ossicle of the middle ear, as the individual ages. Why does ankylosis produce deafness? Ankylosis produces conductive deafness because the ossicles cannot conduct the sound vibrations as they enter the ear. Individuals requesting an appointment for evaluation of decreased hearing are scheduled for the next available appointment that is convenient for them. A diagnosis of otosclerosis is made by the physician using an audiogram, the patient history, and otoscopy. This diagram shows bone fusion around the stapes, which impairs the transmission of sound to the inner ear. The condition may cause difficulty hearing soft or low-pitched sounds. Surgery restores mobility to the ossicles and improves hearing in most cases. Hearing aids may be used if surgery is not an option. Meniere's disease is a chronic disease of the inner ear that affects the labyrinth. Individuals reporting these symptoms require prompt assessment and intervention. What are the predisposing factors of this disease? Predisposing factors for Meniere's disease are middle ear infections, head trauma, dysfunction in the autonomic nervous system, noise pollution, and premenstrual edema. Long-term treatment could include following a salt-free diet, restricting fluid intake, and using diuretics, meclizine, and mild sedatives. Limiting the amount of caffeine and alcohol in the diet and stopping smoking may be recommended. Benign paroxysmal positional vertigo, or BPPV, causes sudden spinning sensations triggered by changes in head position. It results from dislodged calcium crystals in the inner ear affecting balance. Symptoms include nausea, vomiting, dizziness, and difficulty walking. Treatment includes canalith repositioning maneuvers and vestibular therapy. Labyrinthitis is an inflammation or infection of the labyrinth of the inner ear. Individuals reporting sudden onset of fever, vertigo, balance problems, and nausea and vomiting require prompt assessment. The diagnosis of labyrinthitis is based on the results of several tests, including audiometry and blood, neurologic, caloric, and possibly imaging studies. Antiemetic agent. Nausea and vomiting. This diagram illustrates the labyrinth, the complex inner ear structure responsible for both hearing and balance. The cochlea processes sound waves and sends signals through the cochlear nerve to the brain. The semicircular canals, filled with endolymph, detect changes in head position and are essential for maintaining equilibrium. The vestibular nerve, along with the cochlear nerve, forms the vestibulocochlear nerve or cranial nerve 8, which carries both balance and hearing information to the brain. Disruptions in the labyrinth can lead to symptoms like vertigo, dizziness, or hearing loss, as seen in conditions like Meniere's disease or labyrinthitis. A ruptured tympanic membrane or eardrum may result from trauma, infection, or sudden pressure changes. Symptoms include sharp ear pain, hearing loss, and sometimes blood or fluid discharge. Common causes are inserting objects into the ear, loud explosions, or untreated otitis media. Most perforations heal on their own, but antibiotics may be prescribed to prevent infection. This image shows discharge from a ruptured eardrum. Management includes avoiding water exposure and monitoring for healing. In persistent cases, a tympanoplasty may be needed to close the hole. Prompt medical care reduces the risk of chronic infection and hearing loss. This image shows a ruptured tympanic membrane with fluid discharge, indicating a middle ear infection or traumatic injury. A rupture can occur from barotrauma, foreign objects, or pressure from otitis media. The white fluid leaking from the ear is typically pus or serous fluid and may be accompanied by hearing loss, pain, or tinnitus. Treatment includes keeping the ear dry, prescribing antibiotics if infected, and monitoring for healing. Most ruptures heal on their own, but severe cases may require surgical repair with a tympanoplasty. A cholesteatoma is an abnormal growth of keratinizing squamous epithelium in the middle ear or mastoid. It often develops after repeated ear infections or a perforated eardrum and can erode surrounding structures, including the ossicles, leading to conductive hearing loss. Symptoms may include chronic ear discharge, a painless mass, and progressive hearing loss. As the cholesteatoma expands, it can invade the inner ear, facial nerve, or even the brain if untreated. Management includes surgical removal, typically via mastoidectomy, and long-term follow-up to prevent recurrence. Cholesteatomas can start in infancy or develop later due to chronic otitis media. In some cases, eustachian tube dysfunction contributes to its formation. While medications like steroids and antibiotics may help control inflammation, surgery is typically required to fully remove the growth. Ongoing monitoring is critical to prevent recurrence and protect hearing. Mastoiditis, whether acute or chronic, is inflammation of the mastoid bone or mastoid process. The diagnosis is made from patient history, otoscopy, audiometry, radiographic studies, including radiographs and CT scans of the mastoid, and the results of blood and culture studies. Mastoid that is not responding to this treatment necessitates a surgical procedure called simple mastoidectomy to prevent further complications and to preserve hearing. Mastoiditis is an infection of the mastoid bone, located behind the ear, and is often a complication of untreated otitis media. Symptoms include pain, fever, swelling behind the ear, hearing loss, and occasionally headache or chills. The condition is usually caused by Streptococcus species. Treatment includes 4 antibiotics or surgery to drain the infected area. Sensorineural hearing loss results from damage to the cochlea or the auditory nerve. Patients may report ringing in the ears or tinnitus and have trouble hearing in noisy environments. Causes include aging, noise exposure, certain medications, and viral infections. Early intervention is key, as the hearing loss is usually permanent. These graphs highlight how exposure to loud sounds over time contributes to sensorineural hearing loss. Graph shows that as decibel levels increase, the safe exposure time drops dramatically. Exposure to sounds above 100 decibels should be limited to just minutes. Prolonged exposure can cause permanent damage to hair cells in the cochlea. Graph B illustrates common sounds and their decibel levels, from normal conversation to jet engines and concerts. Protecting your hearing by limiting exposure, using ear protection, and avoiding repeated loud environments is key to preventing irreversible hearing loss. Ear cancer can involve the external ear, middle ear, or inner ear structures. Symptoms may include persistent discharge, a visible lesion, progressive hearing loss, and balance issues. Some tumors, like glomus tumors, cause pulsatile tinnitus, a rhythmic sound matching the heartbeat. Squamous cell carcinoma is one of the most painful and aggressive ear cancers. Acoustic neuroma arises from the eighth cranial nerve, whereas facial neuroma is a tumor of the facial nerve. Glomus tumors are the most common tumors of the middle ear and arise from the glomus bodies. Tumors of the ear are often first identified because of the symptoms they cause. Examination of the ear may reveal a BCC or squamous cell carcinoma or SCC lesion, a mass in the external ear canal, or evidence of one of the other neoplasms. Radiation therapy is used if the tumor is known to be aggressive. An acoustic neuroma, also called a vestibular schwannoma, is a benign tumor that develops on the vestibulocochlear nerve cranial nerve 8. Symptoms include hearing loss, tinnitus, dizziness, and sometimes facial weakness or numbness. As the tumor grows, it can compress surrounding nerves and even the brainstem. Treatment includes monitoring, microsurgical removal, or stereotactic radiosurgery.